Hi, and welcome to the Fancy Comma YouTube. Today I'm joined by Dr. Ya'el Courtney. She's a postdoctoral researcher at Stanford University where she investigates the mechanisms driving post-acute neurological conditions following infections such as post-COVID-19 syndrome. With a PhD in neuroscience from Harvard, her research has uncovered how the choroid, plexus, and cerebrospinal fluid contribute to brain development. An advocate for science communication, Dr. Courtney has led workshops and developed resources to guide aspiring scientists, emphasizing accessibility and clear communication of complex ideas. Her work bridges cutting-edge research with a commitment to public engagement, inspiring others to connect with science meaningfully. Welcome, Dr. Courtney. So tell us about your research bridging neuroscience and immunology. Basically, it sounds like you study long COVID, so tell us about that.
Yeah, that is exactly what I am just starting to study in my postdoc. So I wrapped up my PhD in September, and I'm kind of in a transition era between my PhD and starting my postdoc research. So what that functionally means is I'm not in the lab yet for my postdoc, but I've been brainstorming the project a lot and meeting with the group. And actually, in just a couple of weeks, it'll be feet on the ground. But what I will be doing project-wise is looking at long COVID and considering how the body's immune system might be interacting with the brain in negative ways long term and what triggers that in long COVID and why some people, not others. And it's kind of rooted in this idea that long COVID likely shares a lot of mechanisms with other illnesses that come after acute viral infections, with the idea that this isn't a completely new phenomenon. It's new in the sense of COVID, but it's not new that sometimes people get sick with a virus and don't get better for a very long time. And myself, as well as a lot of other scientists, think that there may be some really shared mechanisms across multiple of these disorders that would help us get at it for treatment more effectively.
So that's a really important area of research, especially because I know I've written about long COVID, people that have long COVID. They had a really hard time getting diagnosed, and even now, the long COVID advocacy is not inclusive. There's one lady that I know that helped inform the long COVID guidelines that came out from I want to say like CDC, but it's not perfect, and there's so little really known about it, and a lot of researchers are pivoting to this now because it relates to a lot of different issues that have been neglected for a long time, different chronic illnesses. And there's this whole advocacy community dedicated to talking to lawmakers about long COVID. So I'm sure they find your research really interesting. Have you connected with them?
Yeah, patient advocacy communities, especially, are one of, I think, the most valuable parts about doing any kind of human research. And I want to also acknowledge, like prior to long COVID, advocacy being a very passionate group of people, which it is, there's also for decades been people with myalgic encephalomyelitis or chronic fatigue syndrome, which they abbreviate MECFS, who have been very vocal advocates. And it's another condition that's been like ignored by a lot of healthcare professionals. And I think scientists, hopefully now, and I hope this momentum continues, are starting to listen a bit more to patient communities. So, predominantly through social media platforms is how so far I've been able to connect to advocacy groups for long COVID and MECFS. And there's a lot of overlap, I think, between the goals of the two groups. And I'm looking forward to becoming even more involved as I do my research to make sure it stays aligned with like patient interests, patient goals, and what everyone wants, and then also translating this into effective actual public health measures instead of just publishing a paper that might be a really cool real finding but doesn't end up really going anywhere to improve outcomes for people.
I think that's the most important part of this work because I know that because I gave a talk once at the National Museum of Medicine or something like that. It's in Silver Spring. It's like a military museum, and it was about PTSD. And I gave this talk about everything I had studied for 5 years about PTSD. I think it was more than 5 years at that point. And then at the end, this veteran walked up to me and he was like, PTSD isn't really like that. So I was like, and for a while I had been studying it. I had been reading the articles, and I was like, okay, that's weird. And half of me was like, this guy hates me and just thinks I'm because I'm a woman in science. Like maybe they just thought I was kind of not knowledgeable. And it wasn't just veterans and every day. It was like doctors from the local universities were there and everything. It was kind of but that was the only person that came up to me was someone who I had ostensibly studied telling me that my research didn't apply. So then after that, I left academia, but then I volunteered at the VA recently here in Oklahoma City, and I talked to veterans and they had PTSD, and it wasn't part of my job. but I asked them about their symptoms, and a lot of them were also addicted to various substances as a result of their PTSD, like just to cope better. And so that got me thinking about, and I ended up publishing a paper about PTSD recently as an independent researcher, like, but I didn't cite these people. I just talked to them, and it kind of helped me redirect my research and kind of ground everything I'd been learning from the literature in this new frame. And I think it's hard because as scientists, we're always thinking about what the literature says, but the literature doesn't tell you about the real world as much as just talking to people does. So, one of the things I wanted to ask you about is obviously your work can create a lot of tangible benefits for individuals infected by post COVID, especially given the neuro and immunological aspects of long COVID, which I think those are the two of the main ones. But I wanted to focus more on your idea of grassroots science communication, and like, I'm a grassroots person as well. So tell us about grassroots science communication and what it means to you and why it's important.
Yeah, I would love to. So I actually was just reading a blog on your website that starts to get at, I think, the root of the idea for me, which is about the Pew Research Center's report about like public trust in science. And I think that we've seen over the past few years this kind of loss of public trust in science. And it's something that I've thought about a lot for many years and didn't have really the resources or knowledge to know how to maybe help that. Because as a scientist, it's really important to me. I consider science as, an objective process through which we're trying to get at truths. And the more I realized that the public doesn't necessarily believe that's what scientists are putting forward, it was really kind of a cognitive dissonance for me that I spent many years thinking about how to work on and how to communicate science to people in a way that was warm and trustworthy and heard and received. And it wasn't kind of received assuming I had all these ulterior motives. So this ultimately led me into this idea of grassroots science communication, which I consider as peer-to-peer sharing with people, either one-on-one when you're out in public with your friends, with your family, with your server at a restaurant, or through social media, and just coming at it as a human who's talking to other humans about what I love and what I do, and trying to kind of break down concepts that have been gatekept and made inaccessible for a lot of people, trying to explain them in simple terms. And also, I think something I've realized is very important is acknowledging what science doesn't know and what science has been wrong about to establish this kind of trust and shared ground with people. And I started doing this probably intentionally in college with things like gene editing and gene therapy, as well as genetically modified crops. And then over the years, I've really, during the pandemic, I started talking to people a lot about virology and vaccine science. And then also as a neuroscientist, one of the biggest things I study is if pregnant people take medications that could be bad for a baby's brain development. What do we know about that? And so I spend a lot of time talking to people about that as well. But I think it's still something I'm working and growing in. And I hope a lot of scientists are turning their attention towards and thinking about how we can be talking to people every day about science in a way that makes it more transparent for everyone.
Those are, yeah, that's really important, especially for long COVID, because the people that have long COVID, they're, some of them are scientists, and that's really sad because there's a lot of brain fog associated with long COVID, and I don't think you're really able to do a lot after you are diagnosed with long COVID. But for the most part, it's like all kinds of people. I've actually talked to a lot of people in the long COVID space from when I was reporting on this story about, and it got accepted to NPR and then pulled because there was so much news happening back in 2021. And I talked to the head of the long COVID patient led thing. There's a number of different communities. And I know Bernie Sanders in the Senate is like huge on supporting people that have long COVID and making sure that there's funding to study long COVID. So I guess that's relevant to you also as a researcher of long COVID. There's a lot of interest from people that have long COVID because it's not well understood. And a lot of people, do you know what percent of the population has long COVID? I think it's like a pretty substantive number.
Yeah, so there's a lot of working definitions of long COVID by the loosest definitions, which is persistent symptoms 3 months after initial infection that are negatively impacting your day-to-day life. It's up to 30%, but with a bit stricter definitions, it tends to be around 10 to 15% of people, and it can last anywhere from some people's symptoms kind of start resolving after a year. Some of them are not resolving after a couple of years, and right, it's only 2024, so the longest term we kind of have is 3 to 4 years, but there are some people who still aren't better after that time. So it's a huge percentage of people. And while some get better, many don't. And so many, and increasingly many, as people continue to get infected, are going to be suffering here.
Yeah, so let me back up and explain to anyone that has just completely lost us in this discussion what long COVID is. So there's the acute phase of the infection, and that lasts for, I think I had COVID when I had it for 2 weeks at most, and then I couldn't smell. And I got so super paranoid that I would never be able to smell again. But that came back after weeks. So all in all, I was like sick for 3 weeks. But then for some people, they don't get better. So then they will have the symptoms for, or they might get better, but the symptoms last for like a month or like 3 months, or like some people I've heard their COVID symptoms are going on for years. And I always read about this on like random internet, like social media sites where there would be like someone with long COVID, and it's kind of scary because they're like, oh, I lost my sense of smell when I got COVID and I've never gotten it back. And it's been like 3 years. So like when I lost my sense of smell, I was Googling around because there's no research on this necessarily about like why did my sense of smell go away and is it coming back and what are some things I can do to make my sense of smell come back better. And so I was like combing through all this stuff, forums, and I imagine that's how it is for long COVID people too, just like combing through forums trying to see like which of these is like something I can actually use and what of this is just because you want every time you see something like that you want to be like, well, what kind of COVID did you have, like how long did you have it, what are your risk factors, and like do this like empirical study of them. But that's not possible, so that's why your work is really valuable to these people, because their COVID symptoms have lingered for a while and maybe some of their symptoms got better but not all of their symptoms got better, or like they have this one lingering symptom, or they just don't have any energy anymore and they now have a chronic illness whereas they were perfectly healthy before, which is really that affects our workforce. Obviously, it affects these people's health, their healthcare expenditures, and everything. The impacts are very widespread through society. So, I guess let's go back to this question of how do you see your work translating into tangible benefits for individuals affected by chronic post-infectious syndromes?
I think there's kind of two spaces where I hope for tangible benefits. One is in more kind of healthcare and policy, and one is in like treatment. The healthcare and policy side has to do with something you mentioned earlier, that people historically and still have had a lot of trouble getting diagnosed. And that's for a few reasons. One is we don't have a single biomarker to test you and be like, yes, you have this thing in your blood, you have long COVID, right? It tends to be this process of, oh, you're not feeling great. You haven't been feeling great for a long time. You think it started when you had COVID. Oh, do you have a COVID test? Oh, you took your own test. And this is bad for a few reasons. One, if people don't know what it is they're struggling with, that's hard psychologically. But two, though we don't have tremendously effective treatments for long COVID yet, there's many that are being tried. If you don't have a clear diagnosis, then your insurance isn't going to cover anything in terms of trying to help you get better. So I think scientists working together to create a very clear diagnostic definition and hopefully a few biomarkers, which I've seen some exciting papers on. I think we're pretty close to having some good biomarkers. Then hopefully patients can at least get a clear diagnosis, and then their insurance will support whatever treatments are currently the best practice for whatever symptoms they're struggling with. And so I definitely hope for a tangible benefit to be clear diagnostic procedures, enabling more straightforward health insurance coverage for people. And then within the next few years, something I'm really hoping to do is bring better informed treatments, both preventative treatments for long COVID. So my vision for that is something that when you test positive for COVID, if you take this thing, then your risk of long COVID will be greatly reduced, as well as people who are, months or maybe a year into long COVID, a treatment that will help cure, not just alleviate and kind of bring down some of their symptoms. But my postdoctoral work is looking at what we believe is the root cause for some people suffering with long COVID. A lot of scientists, when I say we, a lot of scientists and doctors think there's probably a few different triggers and a few different types of etiologies that start this in people. But we think we've figured out, one subset, and we're very hopeful that if we're correct and over the next few years are really going to be working in a targeted way at this question, hopefully we can also come up with a treatment for people who have it if it was triggered by this set of things. But I think really I'm most hopeful for this prevention idea in the future, that the more we understand about what triggers chronic illness during acute viral infection, the better we can prevent this from becoming a widespread phenomenon again.
Yeah, and I have done a bit of work in this space, and it was for a business. The acute phase of the COVID infection, there's a number of vitamins and there's also medications you can take. Now there's Paxlovid type drugs that will just like I have to put my science hat back on. But it's like, as I explained to Yael before recording, I was literally just playing with makeup and talking about science policy and my thoughts on the next 4 years of science policy in the Trump administration. And so this is a completely different perspective for me to just get into the science of it. But there's a lot, but it's like fun. It's fun to do like the science part and the policy part. So for the COVID acute phase, there's a number of vitamins you can take that are, they're not even special vitamins. They're just like the type of vitamins that you would take when you have a regular cold, like vitamin C or vitamin D. And like these are known to have antiviral properties. There's a lot of antiviral, anti-cancer, anti-thrombotic agents that will just basically tackle the COVID virus. And a lot of those I learned from my work also are involved in the long COVID, according to what people are thinking. Like there was one, especially for people that are like chronically ill and very seriously ill, like addressing vitamin deficiencies helps them a lot and stuff like that. So, but these aren't like things that have been rigorously studied. I mean, they have been studied on some level, but not in the context of COVID, just in the context of like viruses. And I'm curious about this, and I wonder if you can answer this because you're a COVID scientist. To what degree is COVID as a virus like similar to previous viruses? Because like the COVID vaccine doesn't work like the polio vaccine does. Like when you get the COVID vaccine, it's kind of like the flu, I think. You can get it and it'll protect you against the flu. So how does COVID, what makes COVID so unique and it gives it this post-COVID thing?
So it is similar to other viruses in some ways. Viruses are crazy things, right? And there was a SARS-CoV-1. So, COVID is SARS-CoV-2. And so we have dealt with these SARS respiratory viruses before. But I think you're definitely right that it's more similar to the flu than something like the polio vaccine because COVID mutates a lot. It changes a ton. And so when our bodies learn how to fight one version of it off, it mutates into a different version that our bodies are worse at fighting because as a virus, its goal, right, is to infect hosts and be able to replicate and spread. That's what it wants, if you will. I think that's made it challenging to have, vaccines that have long-term effectiveness because the more effective the vaccine gets, the more COVID is going to want to mutate and be more effective at infecting people. In terms of these long-term conditions coming from it that we haven't maybe seen as much before, I think part of what's actually happening is that these conditions have always accompanied viral infection, but it's pretty rare that across the world, almost everyone gets sick with the same virus at the same time. And so I think part of what happened with COVID is that we were more equipped because everyone was getting sick at once and everyone was paying a lot of attention to this virus for people to start realizing together that some people weren't getting better. But in the past, there's been long adenovirus, for example, which is another virus that when you get sick with, it can feel like a really bad cold or kind of flu-y even. But it's another little encapsulated virus. And there are a lot of people who have long adenovirus and these long symptoms after that. There's people who get long flu. There's people who get sick long after bacterial infections. So I think COVID is a little bit worse in the sense that there are more people who seem to be struggling for longer. But I think, again, part of what happened is just everyone got sick together, if you will. And also, once more awareness was brought to it, I think there's a lot of people prior to COVID that maybe you get a little sick with a virus. And then a month later, if you're still a little sick, you're just like, oh, that lingering cough, or oh, I've been kind of tired ever since I got sick, but whatever, it happens. So I think it's a mix of there's something about COVID that makes people more prone to get sick for a long time, but more attention is also being brought to not recovering after you're sick.
It's a lot to unpack because on one hand we have averting pandemics, and then we also have this other problem which I don't know if people like the pandemics of the past, if they also had this post disease thing that use long COVID unique in history, or have others, the flu, have this, or what do you know about the
I
history of
actually,
having chronic
I need to
disease
look
from
at,
this?
I'd be really curious to look at the 1918 flu epidemic and if there were long viral cases documented after that. My understanding broadly is that over the decades and centuries, it's been very rare that people have felt almost privileged enough to bring up these conditions because they feel like it's not that bad of an illness. And doctors historically have been very dismissive, I think, of people who are struggling if they're not actively in the acute phase of viral infection. So ME/CFS was very derogatorily called white woman's flu through the 1970s and 80s because doctors noted that there was this thing that white women seem to be suffering with. And it's really just that I think white women in this case had access to doctors, had the money to pay doctors to consult, and were only afflicted with this. This was kind of the biggest affliction they had. And so they felt empowered to go to their doctors to share it with them and to share a very real condition that they are absolutely not the only people affected by, but the only people in a place to share with their doctors. So to go back to your question, the answer is I'm not actually sure if with previous viral pandemics, if there have been widely documented long-term chronic illness that followed. But I'm going to look into it. And if there wasn't, I wonder if part of it was a reporting issue or a doctor's not taking it seriously issue.
That was what I found when I started. So I watched this, it was actually a congressional hearing on long COVID, and they had a woman named Shamir Smith, and she now is married and has a different name, and I can't remember her new last name. But Shamir had this problem where she went to, and I wrote, and I'll link the article and see if I can find the hearing and link that as well. From it was quite a few years ago, but basically she had COVID and she had long COVID, and she went to a bunch of different hospitals, and they were all like, I have no idea, like maybe you just have anxiety. And she had like brain inflammation. She had a lot of really different symptoms that were not anxiety. And back then, there was no standard long COVID diagnosis guidelines. Some doctors thought long COVID was real. Some doctors didn't think long COVID was real. So that was a huge problem for her because she basically, even though she had health insurance, she still basically went bankrupt trying to get this diagnosis of long COVID. And what actually ended up working was I think in the end, it turned out to be her doctors weren't believing her and listening to her. And so she went to two Black doctors. She was an African American woman. And they were the ones that were like, we hear you, we believe in you, we believe that what you're telling us is truly a real symptom. And there's a long history of, we're having this whole discussion about the medical system now that United Health guy got, I guess, murdered. And it's interesting because I was just on Capitol Hill in September talking about the healthcare system and patient safety, and I had some really productive conversations with my lawmakers about these types of issues, like why don't doctors believe patients? Like, it's kind of related to the toxic culture of medicine where doctors are like the experts, and there's a hierarchy, and anyone that speaks up lower in the hierarchy, they don't get believed or heard as much. And then like the patients, the doctors don't have time. They're working in the system that's very complicated, and they have all this filling out paperwork. And so a lot of things kind of get lost in the shuffle there. And that's why patient centricity is becoming like a huge thing in the medical world, like making sure that the patients are being put at the center of their healthcare. And I think that long COVID people are probably the best example of this that we have in the current time because they're so politically engaged, even though they don't have any energy. With the energy they do have, they pour into advocating and educating people. And it's because I was following the long COVID people, and I was reading their one pager, and I tried to give them some tips on their one pager because I write one pagers and stuff like that as my job in political communications. So I tweeted at them like, hey, you guys could add this. And they wrote back and they said, you know what, I have limited energy and resources, and this is the best I could do in the resources I had. And I had not even realized that these people are doing all of this kind of with their disability, just like persevering through all of it, which is really hard. But also, that's kind of what grassroots advocacy looks like. It's like whatever energy you have, like in an ideal world, like long COVID would have like lobbyists. We're almost done with this conversation, but yeah, so grassroots, it looks different than a very well structured PR kind of campaign. But I think that the grassroots can be very powerful because all political movements that are successful are grassroots. They don't come from the top down, especially here in the US. So the grassroots aspect, connecting with people that have long COVID. I just read this book, Science with Impact by Anne Toomey, and she talks about this. Talking to people. Have you read that book?
No, but I'm actually putting it in my Amazon cart because I read your review on it. But it's $70 in Australia, so I'm gonna wait till I'm back in America and I can get it shipped there.
It's a really good book. I definitely recommend reading it. It tells you about ways to craft your hypotheses to be more impactful for society and also to be better noticed by lawmakers and stuff. I think that might be really important for your work as a long COVID researcher because there's a lot. Long COVID people are constantly going to Capitol Hill. So let me ask you this last question that I have. How can science communication empower communities and influence public policies?
Something that I've been thinking about for years and I'm thrilled that more scientists are starting to think about is that I believe we have an ethical responsibility to engage with the public, largely because many scientists are funded primarily by taxpayer funds through the National Institutes of Health and the grants that we get from them. And so I think, we all should want to engage with the public and engage their communities. But also, I think that scientists need to. I think it's our responsibility because we're getting paid by them. But I think that the more scientists are transparently and humbly engaging with their communities, the more we can work together to acknowledge where science needs to progress, where we do not understand things, and then align it with the goals of the communities, right? Like you were saying about these patient communities, but this doesn't only have to apply to long COVID research, right? This can apply to environmental health research. This can apply to transportation infrastructure research. It can apply to any kind of research that can have tangible benefits for a community. So by going to the community and asking, what do you want to see from this work? If you're a patient with long COVID, what do you want? Do you want, like, what's the worst symptom you have? Is it the fatigue? Is it your physical symptoms? Is it getting lightheaded every time you stand up? Is it not being able to exercise? What's the most important thing to you to fix? And so I think that by aligning the community and asking what the goals of the target community for your research are, then you can make sure, like you said, you're designing hypotheses that are actually going to advance work that's going to help the people who need the help. And then as you're going through the work, you can maintain this open channel of communication with people, publish your findings, and hopefully work to implement them in a way that makes them accessible and implementable and not just something that's going to sit on the bookshelves of PubMed and be read by a few people, but never bring good to the community. So I think that by starting communicating early in a project, in the design of a project, and maintaining that communication, whether that's with the patient communities or with the bartender at local bar or your hairdresser. I have this notes app in my phone of people I've promised to email my research when I'm allowed to share it about certain topics, just that I met at a party somewhere. But I hope scientists are increasingly motivated through both the events of the pandemic and the political administrations of the past really 10 years in America to become even more involved so that from the start of a project, we can be integrated with the public and not trying to play catch up once things have already kind of gone awry on a large scale.
I think that's a really good insight and really good takeaway. And it's really heartening to me that you as a scientist are, and I guess like it sounds like Fancy Comma has like kind of helped you with that, which I find that really cool. And I'm glad that you took the time to check out our blogs because that's why we kind of
It's
wrote those is
wonderful.
because thank you. I really do think that we need to build up our science capacity in policy. And because, scientists are experts in science and we're the go-to people on science. And so policymakers do look to us, especially in politicized times. We're constantly in those kinds of times. And science is not Republican or Democrat. It's kind of just there to be a process that we can find truths to help people. So, and I think Republicans and Democrats believe that, and that's kind of what's so great about science. And so I'm glad that we as scientists are starting to think about that a bit and trying to realize our impact in the political field and also to help people more because especially for us biomedical researchers, that's why we go into it is to help people. So I'm really grateful for your time today. Is there anything else you want to add or anything cool you're doing that you want to shout out or anything?
I'm not sure. I'm really thankful to have had the chance to talk to you. It's exciting, and I also very much advocate for the Fancy Comma blog. My little shout out will be to the guide I just read about how to get involved in Congress as a scientist and all the different ways you can start engaging there. I think that's something that I've recently realized is super important, and I'm starting to do more of, is actually engaging with lawmakers. And so I think that's what I'll leave people with, just a shout out to continue thinking of ways you can actively be engaged in your community and then in government, whether that's local government or Congress. And Fancy Comma has some good guides to get you aligned with what opportunities are out there.
Yeah, thank you so much for that, Yael. I really appreciate that. And I just published that guide yesterday. So thank you for checking it out and thanks for talking to me and good luck with your research. And yeah, thanks for your time today.
Thank you so much. It was great to talk to you.